Assalamualaikum warahmatullahi wabarakatuh to our respected lecturer, Madam Nurdiana binti Muhammad Nordin. So we are pleased to present our paper entitled Information Governance in Healthcare Industry, Challenges and Solutions.
The study examines health information governance, or HIG, within healthcare organizations. The research focuses on its key components, the challenges faced during implementation, and strategies that can strengthen information governance practices. As healthcare organizations increasingly rely on digital technologies and electronic health records, managing health information securely and accurately has become more important than ever. Although many organizations have already established governing policies, challenges such as data security, privacy protection, regulatory compliance, and staff awareness continue to affect effective implementation. Overall, the study highlights that strong governance practices are essential to improve healthcare quality, protect patient information, and maintain public trust. Information governance refers to the policies, processes, and responsibilities that ensure information is created, managed, stored, shared, retained, and disposed of appropriately throughout its life cycle. Within the healthcare industry, information governance is particularly important because healthcare organizations manage highly sensitive patient information. Accurate and reliable information supports clinical decision-making, improves patient safety, and ensures high-quality healthcare services. With the rapid adoption of electronic health records and other digital technologies, healthcare organizations now generate significantly larger volumes of information than before. While digital transformations have improved operational efficiency, it has also increased the responsibility to protect healthcare information from unauthorized access, cyber threats, and data loss. Despite these advancements, healthcare organizations continue to experience challenges, including maintaining data quality, ensuring regulatory compliance, protecting patient privacy, and improving staff awareness regarding information governance practices. Therefore, this study aims to examine current health information governance practices, identify existing challenges, and propose suitable strategies for improvement. Next, the study was conducted based on 3 research objectives. First, to explore the key components and frameworks of health information governance within healthcare organizations. Second, to identify challenges faced when implementing effective governance practices. Finally, to determine strategies that can strengthen health information governance and improve healthcare data management. Based on these objectives, 3 research questions were formulated. These questions focus on identifying the key governance components and frameworks, understanding the implementation challenges, and exploring strategies that can improve healthcare information governance. Next, for the research methodology, this study adopts a qualitative research approach using document analysis. Relevant academic journals, books, reports, and scholarly articles were systematically reviewed to collect reliable information regarding health information governance. The collected literature was analyzed using content analysis and thematic analysis to identify recurring themes, common challenges, and best practices reported by previous researchers. This approach enables the study to provide evidence-based findings by synthesizing information from credible academic sources.
Now, let's look at the reality on the ground. Why it is so difficult to implement perfect health information governance? We face 3 major challenges. First is data security and privacy. Healthcare data is highly sensitive. It's not like retail data. If hackers breach our system, it's not just a loss of privacy, it destroys public trust. And trust is the hardest asset to reboot once it's broken. Second, we face strict compliance and regulations. Healthcare laws are constantly evolving and deeply complex. If we make a mistake, the organization faces massive financial penalties. legal lawsuits, or worse, the suspension of our operational license. Third, and perhaps most importantly, is staff awareness and training. We can have the most advanced cybersecurity technology in the world, but if our staff isn't properly trained, human error will happen. In fact, human error remains one of the leading causes of data breaches in healthcare. So, how do we overcome these challenges? We don't just leave them as they are. This next slide outlines 3 key strategies to overcome these challenges. Our first strategy is ensuring high data quality. Data must be accurate and up to date. Why? Because doctors make critical life-saving decisions based on this data. If the data is wrong, the treatment could be wrong. So, data quality is literally a matter of patient safety. Secondly, we need clear policies and governance frameworks. Every single person in the organization must know exactly what their responsibility is regarding data. Clear governance creates accountability, ensuring data is managed efficiently and legally. Finally, we must provide continuous staff training. Data security training cannot be a one-time event. Cybersecurity awareness needs to be embedded into our daily work culture. When our staff is well trained, we drastically minimize the risk of human error. To summarize, while the challenges in health data governance are significant, we can overcome them by combining high-quality data, strong policies, and a well-trained workforce. We can build a secure and trusted healthcare system.
Today, I will present about the key components of health information governance in healthcare organization. First is data quality management. This means ensuring healthcare data is accurate, complete, and reliable. Organization achieve this through data validation, regular audit, staff training, and electronic health record system. Good data quality reduce medical errors and support better decision for patient care. The second component is data security and privacy. Security protects information from cyber attacks, unauthorized access, and data theft. Privacy ensures that patient information is used ethically and remains confidential. Common security measures include encryption, firewalls, multi-factor authentication, and access control. Next, healthcare organizations must comply with law, regulation, and ethical standards. They also need to follow patient consent requirements and record retention policies. Compliance helps organizations avoid legal issues, maintain public trust, and ensure accountability. Information lifecycle management refers to how information is handled from creation until disposal. These stages include creating, using, storing, archiving, and disposing of records. Proper management makes information easier to retrieve, reduce storage costs, and supports long-term preservation. Another important component is risk management. Healthcare organizations face risks such as cyber attacks, data breaches, human errors, system failures, and natural disasters. To manage these risks, they use backup systems, disaster recovery plans, cybersecurity training, and continuous monitoring. Next is the case study or example of health information governance in healthcare facilities in Ghana. For the case study, a study in healthcare facilities in Ghana found that governance policies already existed, but staff understanding was only moderate. Data quality was maintained through audits and electronic systems, although training opportunities were limited. Next, lessons learned from the case study. There are 3 main lessons from this case study. First, continuous training is necessary so healthcare workers understand data quality, privacy, security, and governance policy. Second, policies alone are not enough. They must be properly implemented. Finally, regular monitoring and audits help detect problems early and improve decision making. This slide explains about frameworks of health information governance. Next, this table shows the relationship between the key components of health information governance and the framework that support them. For data quality management, organization can use DAMA, DMBOK and the AHMAD information governance framework. These frameworks help ensure that health data is accurate, reliable and consistent for better clinical and administrative decisions. For data security and privacy frameworks such as ISO 27001, the NIST Cybersecurity Framework and Malaysia PDPA 2010 are important. They protect patient information from unauthorized access and ensure compliance with data protection law. The third component is compliance and legal requirements. Frameworks like COVID 2019 and Malaysian healthcare regulation helps organizations meet legal standards, maintain accountability and avoid penalties. Next is information lifecycle management. The ILM framework ISO 15489 and the Electronic Health Record Lifecycle Framework guide the management of record from creation to disposal, ensuring information remains accessibility and reduce storage costs. Finally, risk management use frameworks such as ISO 31000 and the NIST Risk Management Framework. These help healthcare organizations identify and reduce risks like cyber attack, system failures, and data breaches to maintain business continuity. Overall, these frameworks work together to strengthen health information governance and support safe, efficient, and reliable healthcare services.
Next, let's move on to literature review. So I'll first explain about information governance. Information governance refers to the systematic management of information throughout its life cycle. So its main purpose is to ensure that information remains accurate, secure, accessible, and properly controlled. So the main principles of information governance include transparency, accountability, compliance, and information security, which also helps in the organizations to manage the information effectively and to support better decision making. So next, I will talk about information governance in the healthcare industry. So in the healthcare industry, information governance plays an important role because healthcare organizations depend on accurate information for patient care, research, and clinical decision making. It also helps to improve patient safety and healthcare quality. So early initiatives such as the NHS Information Governance Program and the Caldecott Principles emphasize the importance of protecting patient confidentiality and ensuring information security. So next, the rapid digital transformation in healthcare has increased the use of technologies such as electronic health records, mobile health application, wearable devices, artificial intelligence, and cloud computing. Although these technologies improve healthcare services and information sharing, they also create challenges such as privacy, security, interoperability, and data quality. Therefore, strong information governance is essential to ensure healthcare information is managed securely and effectively. Next, information governance practices vary across different countries. In the United Kingdom, the NHS and the Caldecott Principles provide a well-established governance framework that supports information security and legal compliance. In contrast, South Africa faces challenges due to fragmented governance responsibilities across different institutions, which highlighting the importance of better coordination in information governance. Next, legal and regulatory frameworks also play an important role in health information governance. For example, the General Data Protection Regulations or GDPR protects personal data and ensures organizations to handle information responsibly. Meanwhile, HIPAA established standards for protecting electronic health information by focusing on confidentiality, integrity, and availability of healthcare data. In conclusion, health information governance is essential for ensuring healthcare information is accurate, secure, and properly managed. It also supports better patient safety, healthcare quality, and decision making. Therefore, healthcare organizations should also strengthen governance policies, enhance cybersecurity measures, provide regular staff training, improve data quality management, and continuously monitor compliance with legal and regulatory requirements to ensure effective information governance. That's all from us. Thank you.